Hello everyone, welcome to today's lesson. In our previous lessons, we have studied emergency management awareness and chemical leak emergency response. Today, we will explore 9.3 on-site first aid together. We all know that timely and proper on-site first aid can maximize the chances of saving lives and reduce the severity of injuries. If you were part of Xiaowang's rescue team and the toluene deisocyanate TDI leak at the tank farm resulted in one colleague losing consciousness and two colleagues suffering bleeding injuries, how would you provide on-site emergency rescue? First, let's learn about the basic steps of on-site first aid. On-site first aid consists of the following 7 essential steps. Assess the scene, call for help, eliminate potential hazards at the accident site, check the victim's condition, including vital signs, bleeding, fractures, and soft tissue injuries. Perform immediate rescue for severe or life-threatening injuries, especially for those whose lives are at risk. Avoid blindly waiting for assistance or hastily moving the victim. And finally, ensure timely transport and continuous monitoring. On-site first aid techniques generally include 5 aspects: cardiopulmonary resuscitation, CPR, bleeding control, bandaging, fracture immobilization, and transportation. Based on the scenario, one of Xiaowang's colleagues has lost consciousness and requires immediate cardiopulmonary resuscitation (CPR). Now, let's watch a video to learn the key steps and techniques of CPR. If your colleague stops breathing and has no heartbeat, you must immediately perform CPR, assess the scene, make sure it is safe before proceeding with the rescue, call for help, dial 120 and shout for assistance. If multiple people are present, assign roles for calling for help and performing first aid. Check consciousness, pulse, and breath. Gently tap the shoulder, call out loudly, and observe for any response. Quickly check for a carotid pulse. Place your ear near the victim's nose to detect breath, and watch for chest movement. If the victim is not breathing independently, begin CPR immediately. Perform chest compressions. Place the heel of one hand on the center of the chest, between the nipples. Place the other hand on top. Interlock the fingers and begin compressions. Open the airway. Place the heel of your left hand on the victim's forehead and gently tilt the head back while using your right hand's index and middle fingers to lift the chin. When breath and heartbeat stop, muscles relax, causing the tongue to fall back and block the airway. Opening the airway ensures air can be delivered effectively during artificial respiration. Perform artificial respiration. If there is an obstruction in the airway, remove it first. Pinch the victim's nose, take a natural breath, and blow air steadily into their mouth for at least 1 second per breath, and blow twice in a row, ensuring they are not too weak, excessive, or forceful. Repeat the cycle. Continue alternating between chest compressions, airway opening, and artificial respiration until emergency personnel arrive or the victim resumes breathing. The ratio of compressions to breaths should be 30 to 2 per cycle. To summarize, CPR mainly works by chest compressions, creating a temporary artificial circulation to restore spontaneous heartbeat, and using artificial respiration to substitute for natural breathing, thus re-establishing spontaneous circulation. The specific steps are shown in the diagram. Performing CPR effectively requires practice, not only in mastering these steps, but also through continuous training to ensure proper compression depth at least 5 centimeters, compression rate 100 to 120 per minute, and compression-to-breath ratio 30 to 2 are well understood and correctly applied. However, please note that if a chemical industry worker experiences cardiac arrest, it may be caused by respiratory poisoning. When performing first aid in such cases, keep the following in mind. The rescuer must wear protective equipment and remove the poison victim from the hazardous area before starting CPR. When performing CPR on a poisoned individual, do not perform mouth-to-mouth resuscitation to avoid poisoning the rescuer. Based on the scenario, two of Xiaowang's colleagues are bleeding from different body parts and require bleeding control and bandaging. The purpose of bleeding control and bandaging is to stop bleeding, preserve sufficient blood volume, prevent shock, and buy time for further treatment. What are the methods of stopping bleeding? Let's watch a video first. There are 5 methods for bleeding control: finger pressure method, direct pressure method, tourniquet method, pressure bandage method, and packing method. The finger pressure method is used for severe arterial bleeding in the head and limbs. For severe hand bleeding, press the radial and ulnar arteries on both sides of the wrist to stop the blood flow. For severe foot bleeding, press the dorsalis pubis artery on the top of the foot and the posterior tibial artery between the heel and inner ankle. By applying local finger pressure, tissues are compressed, indirectly pressing the anterior tibial artery to stop bleeding. For severe leg bleeding, the victim should sit or lie down. Use both thumbs to firmly press the femoral artery slightly below the groin, blocking blood flow. For severe facial bleeding, use your thumb and index finger, or thumb and middle finger to press 1 cm in front of the lower jaw angles on both sides to stop facial artery bleeding. The direct pressure method is effective for small, shallow wounds with slow bleeding. Apply clean soft gauze or a handkerchief directly to the wound and secure it tightly to stop bleeding. The tourniquet method is used for severe limb bleeding. When other methods fail to stop bleeding, use a rubber or fabric tourniquet above the bleeding site. Tighten the limb until the artery collapses and bleeding stops. The pressure bandage method requires sterile gauze to cover and compress the wound first. Then firmly bandage the wound using a triangular bandage or wrap. The bandage should cover an area slightly larger than the wound. If sterile gauze is unavailable, sanitary napkins or napkins can be used as substitutes. The packing method is used for deep and large wounds on the neck or arms. Pack sterile gauze inside the wound, then secure with a bandage or triangular cloth. The video demonstrated 5 common bleeding control methods. It is important to note that depending on whether the bleeding is bacterial, venous, or capillary, the appropriate bleeding control method should be chosen. After controlling the bleeding, bandaging should be applied based on the injury location. There are 2 methods: triangular bandage wrapping and bandage wrapping. Common bandage wrapping techniques are shown in the diagram. Through today's lesson, we learned the basic procedures of on-site first aid, the fundamental first aid techniques, CPR, and the bleeding control and bandaging techniques. That concludes today's lesson. Thank you for listening. Goodbye.